Hello everyone, this is Sapna from RPIIT Medical and Technical Campus. In previous videos, we have discussed about the regulation of blood glucose, but in today's class, we are going to discuss about glucose tolerance test. In short, we can say it GTT. This test is also known as GTT, means glucose tolerance test. This test means how much our body can tolerate glucose. So glucose tolerance is the ability to utilize carbohydrates can be determined by this test, glucose tolerance test. Initially, fasting blood glucose is estimated. Then a loading dose of glucose is given. Then the blood glucose level are estimated at regular interval after glucose load. And then in condition of insulin deficiency, blood glucose level get elevated due to impaired utilization of glucose. Then we will discuss about glucose tolerance factors, the conditions in which it is decreases or the conditions in which it is increases. First of all, we will discuss about those conditions in which glucose tolerance is decreased. So decreased carbohydrate tolerance or non-utilization of carbohydrate load is observed in conditions causing hyperglycemia. For example, in case of diabetes mellitus, hyperactivity of an anterior pituitary and adrenal cortex, hyperthyroidism, and then stress. Then we will discuss about the increased glucose tolerance. Increased glucose tolerance or carbohydrate tolerance is observed in all conditions that causes hypoglycemia. So these conditions are hypopituitarism, hyperinsulinism, hypothyroidism, adrenal cortical hypofunctions, decreased gastrointestinal absorption like spore, ileic disease. Then we will discuss about the indications of glucose tolerance test in asymptomatic person with sustained or transient glycosuria, in person with symptoms of diabetes but no glycosuria or hyperglycemia, person with family history but no symptoms or positive blood findings, in persons with or without symptoms of diabetes mellitus showing one abnormal blood finding, in patients with neuropathies and retinopathies of unknown origin, in women with family history of having delivered large babies. Then we will discuss about contraindications of oral glucose tolerance test. In proven cases of diabetes mellitus, the test is not required, but GTT is required only in doubtful cases. It is not recommended for follow-up of patients. The test should not be carried out in actually ill patients. Now we will discuss about the glucose tolerance test precautions. The patient is instructed to have a good carbohydrates diet for 3 days prior to the test. Further diet containing about 30 to 50 gram of carbohydrates should be taken on the evening prior to the test. The patient should avoid drugs likely influence the blood glucose level for at least 2 days prior to the test. Patients should abstain from smoking during the test. The exercise is also to be avoided on the same day prior to the test. Strenuous exercise on the previous day is to be avoided. Now we will discuss about the types of glucose tolerance tests. There are mainly 3 types of glucose tolerance tests. The first one is standard oral glucose tolerance test. Second one is intravenous glucose tolerance test. And third one is mini glucose tolerance test. Thank you. The next we will discuss in next video.